um, take 15 minutes to go through the presentation, and then we will have Claire Wanyama after that. Waziri, karibu.
Thank you. Good afternoon. I promise I'll give a very short presentation, shorter than my height. Be assured. Yeah, I'm Joseph Murega, and I think I'm one of the rare people here because I'm an acting outgoing CEC. I don't know whether there's anybody else with such a title, acting and outgoing. I'll explain behind the tent what that means. My work is simple. It will discuss about county health registration and policies. And thank you, Dr. Mutahakango, because you handled half of my presentation. So be assured I've said you a big thanks. I like to give by examples. You can see this dilapidated book. I use it like my Bible or my Quran. This is the Kiambu County Omnibus Health Services Act. It's as simple as that, but it has done wonders in what I would say, what I have intended to do in my county, because it carries a lot of other registrations and policies which would have attracted more work in terms of creating some policies. I'll be very fast. That's the outline of my presentation, which is the county health sector policy and registration environment. Then we'll discuss about areas of which the county governments have made policies and registrations. This you'll be actually sharing. So we might have an interactive session as I present. Fortunately now, since nobody has hypoglycemia anymore, we need to talk to each other so that we don't attract also a bit of drowsiness after lunch. So we might have an interactive session as I present. Then I also talk about the county health registrations, as I mentioned, the model laws for health, and what lessons have we learned registration and policies in our county level. The session objectives are just two. One is to appreciate the health sector registration, the areas in which the counties have registered, in that process. This slide was virtually discussed by Mutaha Kango, so let me jump that one. The areas which county governments have developed policies and registration is just an example in leadership and government and governance. I hope that's okay. In health financing, and of course in management of special conditions or even individuals. This is like HIV, AIDS, the RMNCH, drug control, public health, and many others. And of course, another one is setting autonomous institutions like county referral hospital, among many more. So also, counties have used policies which were implemented. They also give service as required, like what I have mentioned there, overarching policies. That is a policy which can cover many things, which also can be used in terms of fulfilling what is our mandate. Now let us, the County Services Health Act, overarching registration. Let me give you a history of this booklet. This booklet was only a bill in the first 5 years of devolution. Attempts to make it an act hit the hard rock. And when I came in, I decided to ask for the legal team advice. And the main issue was we needed, that time we called it a revolving fund, because we found that the moment you mention FIF, some of our departments like finance are very allergic to hear of money being retained elsewhere except in CRF. So we discussed a lot with the legal team, and they told me the only way out here, let us hide it in the health service, Kiambu Health Services, County Health Services Act. And that is what we did. So part 6 of this County Health Act is actually the Facility Improvement Fund. This costed my job. I was actually sacked on 28th of August 2018, and for almost 2 years I was out. But unfortunately, when a wave starts, it doesn't stop. The reason is we had discussed a lot with the MCAs, and they really wanted the FIF Act. And actually, they said if it will not be presented by, they actually pass it as a member's motion. And that's how it passed. Now, it was passed and actually gazetted on 12th April 2019. Then it went under the carpet. They could not be implemented because implementation is not about this act. I had decided I will not come back, but he actually called me, you have to come. I was very happy when I found it was already registered and gazetted. Then most of them on between 15 and 70 liters per minute of oxygen. It was not in a workshop, and I told the governor, no, our hospitals will collapse. We are going towards the end of the financial year, and this is a year of transition, so most of the activities that involve finance might be locked. But if we don't have money to run our 14 hospitals, level 4 and 5s, we will be doomed. And for sure, our level 2 and 3s is just the other day, was in Somalia to retire dawa, % remains in the earning facility, and 25 goes to support the team. Now, we can't take this for regulations because the 1 point same act. Slightly in details about the county revenue fund and the county facility improvement fund. Initially it was called cost sharing, and now it has that name. And let us see how many counties have any form of registration on the act. Mukono juu. So we are talking, how many have an active FIF Act, active? Here to see the numbers that we are quite low, and strategize to meet that deadline of next year. So I know we have the act in Embu, and that is, thank you. This is usually easier in this type of an act. So is the County Emergency Health Services Funds Act, and when I went to Google, I think I only found this in Kisii. Is there any other county with that? It's an act. Which counties? Like there is County Public Health and Sanitation Act, which is Nakuru and Mombasa. Then Busia has County Public Health Act. They all have the same things. And of course, you know that in some counties, solid waste is domiciled in environment. Like in our county, that's what there is. We don't know where the boundary is, because whenever there is liquid waste, we are first called, like a sewer, we are first called as public health. And then we are if it is a block, we have to call roads, we have to call water and environment. So in this type of quagmire where there is no clear boundaries, it's remained a challenge. because I know during a local government time, everything was under health. Then there is county environment. Sorry, am I right? Is it moving? Yeah, County Environmental Health and Sanitation Act, NAROC, and others. So the work has been done, although with different names. A very important thing that we need also to be well guided, and COG should take up this, such that we don't give any registration the name we wish. Probably we are doing the same things, but where we benchmark, we tend to copy how it is labeled or how it is named. If we could have like a unifying, we are not changing the contents. The contents have to align with the county needs, because different counties have different needs and different uniqueness. Then the Community Health Services Act, this is the one which has very many who have already either put it as an act or still as a bill. I can see Migori, Kajiado, Nakuru, Siaya. I think Siaya, it was a bill that by the time I made this, I don't know whether it has been made an act now for Siaya. Then Turkana, Vihiga, Homa Bay, Nairobi, and many others. We need this urgently. For us to achieve UHC, we need an active Community Health Services Act, because our level 1, the community health workers, the SCHARs and the CHVs, we need also to think about them in terms of their remuneration, their facilitation, etc., etc. So this is still work to be done in our counties. Then Mombasa, Makueni, Tharaka Nithi have the County Reproductive Health and Family Planning Act. Kisii and Meru has the County Referral and Teaching Hospitals Act. Then Maternal and Child Health and Family Planning in Kilifi, Lamu, Nakuru, Kakamega, among others. HIV/AIDS, there are some with an act, but most of us have it as a policy. It is in our strategic plans, and but I would say it is still well implemented, and of course with support of our partners. There's a unique act mark and see what is happening about that pot. I did not get the details, but it provides for the powers and functions of port health services. In Baringo, we have a County Tobacco Control Act. The details you can see. That's what it does. In the same county, we have County Gender-Based Violence Act. I know we have other counties where we need that. Even in my own county, GBV has become a real monster. It's really, really spreading in the wrong way. Baringo. We also have county model laws. Before election of the first county government, the Law Reform Commission found it necessary to develop. I'm finishing. This is the last. So, so to guide on model laws, like we have the County Health Services model, FIF model, and we seek that COG should also help us to get those models so that we don't involve a lot of moving up and down looking for benchmarking and looking for what are the possible ways of publishing this law or creating these laws before registration. Policies approved by the assemblies are usually strong. These are what we call the white papers. But those of roadside declaration are usually not strong, and they can easily be charged on the others and citizens' participation. Plan effectively and early. minimize wasted efforts. Several bills have actually lapsed, either because they were forwarded late to assembly, and that's what happened to my community health services bill. I supposed to come back, or they are kept too long in our shelves. Inter-county knowledge, which Professor Mutaha mentioned, and experience sharing in policies and registrations